Do I need a blepharoplasty? I am 28 years of age, and it seems to me that my lids are very heavy for a young person. My upper lids are hooded. To open my lids, I must raise my forehead, and that has caused horizontal lines across my forehead. My eyelids feel uncomfortably tired and heavy, and I am concerned that they are now impairing my vision. My eyelashes are always visible and point downwards. Would a blepharoplasty be in order, or do I also have some ptosis in my lids? Any advice would be appreciated.
Thank you for your question. You submitted 3 photos and you're asking about whether or not you're a candidate for blepharoplasty and whether or not there's a presence of ptosis. You also mentioned in your question that you raise your eyebrows to reduce the physical weight on your eyelids, as well as the fact that your eyelashes are pointing downwards. So it is very important that a proper diagnosis is made before you undergo any eyelid surgery. You asked a very good question. Is there ptosis? And so let's get some terminology clear before we discuss further what we would do for someone like yourself in our practice. I'm a cosmetic oculofacial plastic surgeon. This is a surgeon who is specialized first in eye surgery before subspecialty or specialized training in cosmetic surgery of the eyes and face. And so eyelid surgery relating to upper eyelids, lower eyelids, ptosis surgery is something we deal with every day. So I'll share with you our approach and first help you by just getting some definitions provided that you probably have become somewhat familiar with. One is differentiating dermatochalasis, which is excess skin that is over the eye, and that could be part of your issue, which is why when you raise your eyebrows, the physical weight on the eyelid is being reduced and you may feel better because the skin over the eyelid actually causes that physical weight that a lot of times people unconsciously are raising their eyebrows. And it is very common for a patient to go visit a dermatologist and get Botox injections in their forehead to reduce their forehead lines. And then what happens is the brows drop, and then the eyelids look even heavier. So it's very astute that you noticed this this characteristic. The other definition of course, ptosis. Ptosis means drooping of the eyelid, and it's in the strict, and it's defined by looking at the margin of the eyelid, at the point where the eyelashes are relative to the pupil or the center of the eye. So if someone like yourself comes to our practice, we first do some measuring, and one is a ptosis evaluation. It does appear that your right eye is slightly lower than your left in the photos you submitted. Now that doesn't necessarily mean that you need ptosis repair. The evaluation of ptosis requires measurements that include something called margin reflex distance, which is from the center of the pupil, the light reflex, to the margin, as well as the muscle function, the levator muscle function. The levator muscle is the muscle that lifts your eyelid. Then another thing we do is we roll up the skin of the upper eyelid to then see if the eyelid is still low even after the skin is lifted. That is a critically important step in determining whether or not a person is a candidate for a pure blepharoplasty, which is the removal and shaping of the upper eyelid through skin and removal of skin and extra fat and other soft tissue in the upper eyelids alone, or whether they need that or a combination, or instead a ptosis operation. Ptosis operation is typically involving the muscle, the levator muscle. It's a completely different surgery compared to blepharoplasty because this muscle has to be handled just right, and it is really not a procedure that most general or unspecialized plastic surgeons perform. So what is important during the exam is to make that distinction. Now, the presence of ptosis doesn't necessarily mean that it always has to be addressed. Within the normal population, it's generally acceptable to have the difference between the eyes to be about 1 to 2 millimeters. A lot of our patients come in who have ptosis pre-existing since they were young, and they're kind of used to that look. And so they don't come in unless they are bothered because it's gotten worse, or they are concerned that one eye is lower than the other significantly. So there is a certain amount of tolerance of having not the perfect height of the eyelid relative to the pupil. So that's something that can only be elucidated through physical examination. Again, it's about distinguishing physical weight of the skin from the muscle being responsible for the position of the eyelid. A lot of times, just the addressing of the physical weight of the skin is enough for someone to be satisfied and feel good about their appearance. So again, that simple technique of using a Q-tip to lift the skin and see what's going on helps a lot in understanding what the measurements are of the two eyes. With that being said, I think it's important that you meet with qualified, experienced cosmetic surgeons, and I would advise you go to someone who understands ptosis, so that way this is something that is not overlooked. Most doctors who perform eyelid surgery, and I'm talking about the broadest numbers from general plastic surgeons and facial plastic surgeons, do not do ptosis surgery. It's not part of what they do routinely. So it's probably best for you to meet with a cosmetic oculofacial plastic surgeon to get a proper examination and learn what your options are. If it turns out that maybe a slight bit of elevation is of benefit, like addressing the ptosis, that's fine. In our practice, when we do ptosis surgery, we do both ptosis and blepharoplasty surgery under local anesthesia with light IV sedation. When we're doing ptosis surgery specifically, because the muscle is such a sensitive muscle, we actually have the patient open their eyes during the procedure to see what the height and the contour of the eyelid appears. We'll even sit people up to see how they match, to make sure that both the height, the contour, the symmetry is achieved. Patients never feel any pain because they're already numb, but it ensures a higher likelihood that after the surgery everything will look as good as it appears during surgery. So with that being said, again, meet with a specialist and learn about your options. I think your question is very well written, and you really do have a good understanding of your situation, but I think you need a proper physical examination by a professional to really understand what path you should proceed with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.